So first thing regarding psychiatry, which I would really like to emphasize and begin my presentation with is this is not a backup anymore. Get it out of your head as quickly as possible because this is what our seniors have been telling us. This has been what the notion has been over the years. But believe me, in the past couple of years and the trend we are seeing, you probably saw the presentation this morning from the faculty. This is not a backup anymore. So if you're interested in psychiatry, you have to start from the beginning. So keep that in mind, and then we have to talk about how to build up um, and prepare for psychiatry. Can we move on to the next slide, Shifa? Thank you. So here there are bullet points which I created. I'm pretty sure most of the faculty has covered everything in the morning. I've been in this lecture since the morning, and I'm saying so. I'll go with the top three in detail, like start early, choose rotation and electives, and getting experience. LORs, we have talked a lot about LORs. Interviews, we have talked a lot about interviews. We'll also talk about how virtual interview will be this year, so we're going to talk about that later in session. But especially, I would like to focus on the top 3 points. So we'll dive into that. Next slide. All right. So first thing I feel having a right mindset is really important because, as I said, it's not a backup anymore. I am going to keep on repeating. Psychiatry is a very specialized field meant for specific personalities, I should say. A person who is not made for psychiatry and is not prepared for psychiatry, believe me, will have a lot of difficulty, a lot of trouble. I have been in my program, I've seen residents struggling, and eventually they have a setback. So you don't want to do that. Like, you have to create um, a mindset and prepare psychologically. Research about the field. Again, researching a program is different. Research about the field or discipline itself, whether you really want to go into psychiatry or not, pros and cons, and of course, talk to people. Then I previously mentioned, are you genuinely interested or you're desperate to get into residency? Believe me, the panel here will agree with me. We are like we have been interviewing candidates, we sit on panel. It's very much easily pick up whether you're really interested or you're really desperate to get into residency. Of course, everybody who is applying is desperate. I was desperate myself, but you have to hold that back and you have to have a genuine interest. No, it's true for every field, but I'm talking specifically about psychiatry because uh, now over the years people have realized that they have been using this field as their backup plan, and they can just they're showing up or they're applying just because they don't have any other option. And I'm talking about this, the very first filter when your application goes in. Then dealing with the stigma, of course, we all know how the field is looked upon in our back home country, what you guys think about it in your medical school, and what your family thinks about when you start talking about psychiatry. Believe me, when I started talking about my going into psychiatry, my dad and mom literally freaked out. They thought, like, I thought you were going to medicine. I have to tell them, like, well, yeah, this is medicine. So this could be funny, but again, you have to fight all those things. And believe me, the fight is still on. Once you're a psychiatrist, still there are people in field of medicine who are very stigmatized with the psychiatry field of psychiatry itself. So keep all those things in mind. And that's why I say you have to start early. Okay, next slide. Now, coming to the second point, rotation electives. I think we were talking Q&A session. Choosing your rotation in your medical school is the stepping stone. That's where you will get exposed to the field. That's where you start getting comfortable with the patients. That's where you develop that demeanor. Then comes the externship, observership. Of course, I feel there are um, a lot of people who are attending here are still medical school, so they have that opportunity. There are a lot of people who have already graduated from medical school, so they have missed that opportunity. Now, what to do? Now, if you really want to get into field of psychiatry, start looking for externship and observership. Networking is a very important component. Whether, as we mentioned about, you get a position as a researcher, you get a position as a volunteership, try, grab it, go and expose yourself to the environment, expose yourself to the hospital setting, because psychiatry setting in itself is very different from general medicine or any other disciplines of medicine, even surgery. If you talk about, completely different, you will have a complete different feel when you are in there. And of course, getting comfortable with the patient, like you're talking to a depressed patient is a completely different feeling compared to a person who is manic or psychotic or substance abuser, which is a big thing in the United States. Like we usually don't talk about it, but getting that label of addiction is another whole topic to talk. The stigma, how stigmatized the society is. So there's a lot to it. And those things people if I talk about like 5 years ago, they were exposed to those things when they were in residency. Now, in the past couple of years, the medical student, when they come from Caribbean schools or like is doing electives, they are exposed to these environment and they develop interest. And when they develop interest, that's where the program start picking and recognizing the people who have the potential to grow as a psychiatrist and be in the field. So it's really important. I cannot emphasize enough on the opportunity to even do observership or volunteership in a program where psychiatry exposure is there. Okay, next slide. All right, so let's talk about a little bit about red flags in the CV, and then we'll talk about what positive you can do. At this point, most of you have already have the CVs, and I'm pretty sure there is a good percentage of people who are applying to different disciplines of medicine, but also throwing their application to psych as a CV. So these are the red flag which you need to know. A scattered CV where you have worked in every field, whether it's medicine, family medicine, and now you're also applying for psych and putting in a rotation of 2 weeks in psych. Believe me, it's very easily picked up. Looking at the CV, we will be able to figure out whether this person is really genuinely interested in psychiatry or not. Then setting up a personal statement, and this is personal statement is very important. You will get a lecture on personal statement later on. It's true for every field of medicine, especially in psychiatry. Don't try to put in a generalized personal statement. This is especially now when everything is virtual, the interviews will be virtual. This is the most important thing which the person is going to read about you and make an opinion how what kind of person this applicant will be, how much information you want to share in your personal statement, what you want to put down in personal statement. That's something you have to decide. uh, don't give too much of information. I have seen like again, I'm just going to run into a little bit of example. If a person is applying to internal medicine, they talk about how their family suffered from a chronic disease and how the family suffered from uh, cancer and everything. I've seen personal statement applicants talking about struggling with depression, that their brother was using drugs and all that. Is it really relevant to put all those information in there? That's the question. It's a double-edged sword. It's how much information you want to relay. Be genuine, as I think Dr. Boss was mentioning earlier. If it's true, mention it. And wording is important. Don't just make up a story for the sake of writing a personal statement. And this is true for all the disciplines, so wherever you're applying. Um, the other thing which I see is LORs from different disciplines and field of medicine. We are applying to psychiatry. There's not even a single letter of recommendation from psychiatry, a psychiatrist or a psychiatry rotation. This can be a negative point, but if a person is writing a really good letter of recommendation from internal medicine, from surgery rotation, and they are telling that this person has a genuine interest in psychiatry, that kind of letter can be positive. Otherwise, it's a red flag. You don't have any clinical experience, exposure to psychiatry. Believe me, that's a negative point. Um, Next slide. All right. So again, talking about CV, what's the focus should be on? If you are really into psychiatry and you're trying to build up at this point, your CV should reflect what you actually want. That said, like your core rotation, your electives, your um, rotation in a clinical setting or a private, even if you're doing a private clinical rotation, as long as you're able to prove and convince the reader that this is what you got and this is what you got out of it and turn it into your strength. We talked about it in Q&A. That should be your focus, how to polish your CV. Dr. Jaffrey, I think, gave a good lecture on your CV build up. Just use that. Research, a big lecture we had on research. Psychiatry is a field, I should say, even if you're getting a research opportunity to learn about psychiatry, how many people, okay, we just know depression, but how many people actually know what ADHD, bipolar, intermittent explosive disorder, and schizophrenia, schizophreniform, all those things, even if you're getting a opportunity to do a write-up, that will help you to actually know the field of psychiatry so that once you go for the interview, you're able to talk about those things. So take that opportunity at this point when there's often an offer to do our research project remotely, and if you can incorporate that in your busy schedule, do that. Because believe me, once you sit in your interview and they want to talk about what you have been doing, and once you open up that dialogue about what research you have been doing and what kind of diseases and spectrum you saw, that tells you this person has a genuine interest in psychiatry. Cannot miss the importance of step three, especially I think somebody asked in a message, especially when step one is pass and fail, what importance it holds now. Well, other things which holds importance is your attempt is step three. And psychiatry always have been looking for step three, and now of course this is something which is a star in your CV or applicants when you're applying. I already covered personal statement. I cannot emphasize enough on that. As a psychiatrist, even any application, any program you apply, the residency committee actually look at your personal statement, read it very keenly, and it's read multiple times by multiple people. Then interest. This is something again I said interest versus how desperate you are to get into residency. If you show desperation that you are desperate to get into psychiatry, that's very easily picked up. If you're just desperate, that's also very easily picked up. The reason I say it, you have to understand you are being interviewed by a panel of psychiatrists who are constantly analyzing your behavior. In a virtual platform, they will closely and keenly monitor you, your behavior, your expression. So it becomes more important, like how to express yourself, to hold your emotion. Dr. Raza, I think Dr. Shazad Raza mentioned, be a good listener. Yes, listen to what being asked. Don't just volunteer information. Sometimes we don't want to hear a few things, and it's better to just hear what we want to. So I think those are the few things I would touch upon. Um, do I have another slides? I don't think so, right? Yeah. So that's pretty much it. The takeaway point, if I have to say from all the things, if you want to remember, just remember my first slide, remember my last two slides. Those are the things which you need to focus on. Psychiatry, as I said, is my take is psychiatry is a specialized field itself. You go internal medicine, and then you go for fellowship and specialize. Psychiatry itself is a specialized field. So you got to prepare for a specialized field from the beginning.